Last week, I traveled to the Democratic Republic of the Congo, where I had the honor of meeting with His Excellency President Felix Tshisekedi and other leaders and partners. Together, we assessed the response to the Ebola epidemic in the country's northeast and how to address the challenges we face. I very much welcome the President's leadership and commitment to doing everything he can to bring this outbreak under control. It's already the second biggest Ebola epidemic on record, and it's moving faster than any previous Ebola outbreak. At its current pace, it's on track to eclipse the West African Ebola outbreak of 2014 to 2016. Officially, 4,449 confirmed cases have been reported, with 2,061 deaths across 5 provinces and 53 health zones. The outbreak had a big head start. It's still way ahead of us, and we're playing catch up. About 90% of all cases and 80% of deaths are in the province of Ituri, with sustained transmission in the towns of Bunya, Moapara, Nizi, and Lita. Most concerningly, we see a high proportion of deaths in communities instead of treatment units outside of known contact lists. That tells us there are chains of transmission we don't know about. And until we know about and break every chain of transmission, we will not stop the outbreak. Most transmission happens when people have late-stage disease and are not in treatment, or when their body is handled after they have died. Early clinical care and safe and dignified burials are therefore critical for interrupting transmission. And both depend on the trust of affected communities, which means community engagement and community ownership are essential. There is no other way. So, under the leadership of the government, we're now scaling up every part of the response with the primary goal of interrupting transmission. Surveillance is our priority operational challenge. With partners, we're mapping and pooling resources to strengthen community-based surveillance to bring every suspected case into care and reach the 95% contact tracing target needed to interrupt transmission. Today, we're at around 80%. We're also tripling treatment capacity with a goal of 3,000 beds within 12 weeks. We also need to recruit and train 3 health workers for every patient. That's thousands more than we have at the moment. Although we face many challenges, we have also made significant progress. More than 21,000 community health workers have been trained. Treatment centers, safe burial teams, laboratories, and community engagement are operating across the affected provinces, reaching hundreds of thousands of people. And 886 patients have recovered, even without specific therapeutics and vaccines, which are progressing in trials. For the first time, 2 vaccines specifically designed against Bundibugyo virus have now entered phase 1 safety trials in humans. In addition, 2 new animal studies of the vaccine against their Ebola virus, the more common species, have shown promising evidence of cross-protection in animals. On that basis, WHO has recommended inclusion of the vaccine in a phase 3 trial, which we hope to start as soon as possible. We do not know whether this vaccine is efficacious against Bundibugyo disease in humans. The phase 3 trial is the best way to ensure a safe and effective vaccine is available as soon as possible for this and future outbreaks. We call on all partners to support and accelerate this trial. At the same time, we're moving rapidly to generate evidence on treatments. The WHO-sponsored Partners trial has now reached the milestone of 100 patients. This trial demonstrates that even in the midst of a challenging outbreak, it's possible to mobilize research rapidly and responsibly. None of this work is done by WHO alone, or the government alone, or Africa CDC alone. It's all of us working together as one. But special thanks to the United States and the United Kingdom. The challenge ahead is implementing these interventions at the scale and the speed required to get ahead of the outbreak. And that depends on financing. Of the $518 million required for the Continental Preparedness and Response Plan, $264 million, or just over half, has been disbursed. We need financing that's timely, impactful, and sustainable. And we also need access and security in the affected areas to ensure the response can operate safely and effectively, because, as you know, Eastern DRC is marked with active armed conflict. I would especially like to thank all the health workers who are putting themselves at risk every day to save lives and stop the outbreak.